So let's continue treating high peak inspiratory pressure. So let's remember, this is the equation. The proximal airway pressure equal to flow multiplied by resistance plus the plateau pressure, which is the tidal volume divided by compliance. So as we just talked in the first video, we check if the alarm goes off for high peaks inspiratory pressure, as we said, check if it's a resistance problem or not. Is the patient biting the tube or not? If the patient biting the tube, just sedate the patient or control his pain in a better way. And the next thing we do, and I recommend to do it regardless, is suction the airways and clear any secretions or mucus plugs. Again, this is a routine care that the nurses usually do on daily basis on any intubated patients. Now, if it's not a resistance problem, I recommend you perform the inspiratory hold maneuver, which I explained on previous video. Please check that one. Basically, here we're checking the plateau pressure, which is the tidal volume divided by compliance. If it's elevated, and the numbers usually we use 330 centimeter H2O, one way to fix is to, of course, look at this equation and by lowering the tidal volume, which we already explained thoroughly about the importance of keeping the tidal volume 6 to 8 ml per kg in general, and in ARDS to keep it at 6 and sometimes at 5 to help with this issue. And increase compliance. Increasing compliance we talked about in details on previous videos, which is compliance is increasing means the stretchability of the alveoli, right? So if there is ARDS, treat ARDS, pulmonary edema, obesity, pregnancy. So we need to treat. So for ARDS, treat the ARDS, do the lung protective measures, pulmonary edema, give Lasix. But sometimes if there's obesity or pregnancy, you have to do a different trick. As we talked on previously on the peak inspiratory pressure issue, it mainly happens in the VC mode, volume control mode, because the flow is the target, right? But all these problems disappear if we use pressure control mode, because the pressure is the target, proximal airway pressure. So one way to fix and one of the fastest way is to switch to pressure control. But really, switching to pressure control, you have to do it after making sure it's not a resistance problem, because you have to, if the patient is biting, you have to sedate and stop that. If there is a problem, the airways, you have to suction the airways. So if it's obesity, pregnancy, sometimes pulmonary edema or ARDS, switching to pressure control can fix the problem. So that's another option. Also have to remind you, remember that we talked about suctioning airway, but you need to remember about the severe bronchospasm that can happen with airway disease like COPD or asthma, because that can increase the resistance as well. And the treatment is, as you know, bronchodilators and steroids. And those you suspect, if you suction the airway, there's nothing coming, and you know that your patient is going through a COPD or asthma exacerbation. So this is how we tackle a high peak inspiratory pressure problem. As I said, remember, if you are tired doing night shifts, you don't have time or energy to think, making sure it's not a resistance problem first. And second, you can simply, if you don't want to really think about the compliance issue, just switch to pressure control and monitor tidal volume.